In this Florida Live educational video, we discuss the role of a new FMB needle that has been developed for EUS-guided tissue acquisition. It can sometimes be challenging to acquire tissue when a lesion is subepithelial, as it can be freely mobile and difficult to target with patients' respiratory movements. Likewise, small lesions or unsettled masses in the pancreas can be challenging as the needle recoils easily, particularly when the echoendoscope is acutely bent. Also, the liver capsule can sometimes make FMB maneuvers challenging, leading to multiple attempts and bloody specimen. To overcome this challenge, a Franseen FNB needle with tapered point stylet has been developed in the 22 and 25 gauge platforms. Benchtop model has demonstrated a 36.6% reduction in puncture force as compared to a standard 22 gauge FMB needle. When a difficult puncture is anticipated, it's important not to retract the stylet within the needle assembly, but rather use the tapered point to aid puncture. We will now demonstrate 3 cases in which the Acquire S FMB needle was utilized. A 30-year-old patient presented with a nodular lesion in the duodenal bulb. Prior EUS-guided FMB at an outside hospital was suggestive of Brunner's gland hyperplasia. At EUS, after installation of water, a 12mm lesion was seen arising from the deep mucosal layer. Although the lesion was small and mobile, the lesion could easily be targeted with a 22 gauge Acquire S needle. And rapid on-site assessment revealed neuroendocrine cells suggestive of a carcinoid tumor. A 36-year-old patient was referred for evaluation of a 22mm liver mass seen on MRI. The mass was invading the hepatic vasculature. The liver lesion could be easily targeted using the 22 gauge Acquire S needle without any resistance or recoil due to bounce off from the liver capsule. The lesion was sampled using the fanning maneuver, and note the echogenic needle tip visible at all times. Rapid onset evaluation revealed this to be a neoplastic lesion, and additional tissue was procured in cell block for ancillary studies. A 63-year-old patient with elevated liver tests was found to have an 18 by 14mm lesion on CT imaging. On EUS, the hypoechoic lesion was punctured using a 22 gauge Acquire S FMB needle and sampled using the fanning maneuver. Rapid on-site evaluation was suggestive of a high-grade neuroendocrine tumor. A 15mm hypoechoic mass was also seen in the pancreatic tail region, surrounded by intervening collaterals. Final biopsy was performed and revealed this to be an adenocarcinoma. This patient therefore had a pancreatic cancer with metastatic neuroendocrine tumor in the liver, the primary for which was unclear. We believe that the development of the Franseen needle with a tapered point stylet is a useful addition to the EUS armamentarium for tissue acquisition. Thank you so much for watching. If you'd like to watch this and other novel cutting-edge technologies, please attend Florida Live EUS from August 17th to 19th, 2023 in Orlando, where the magic of endoscopy begins. If you want to observe and learn evidence-based practices and know more about state-of-the-art EUS technologies, please attend Florida Live EUS from August 17th to 19th, 2023 in Orlando, Florida, where advanced interventions will be performed by internationally reputed faculty from around the world. Please join us at Florida Live, where the magic of endoscopy begins.